This is the second part of the community and culture presentation. And we're going to move from we left off talking about levels of health promotion and prevention of disease, the primary, secondary, and tertiary levels. And now moving that into nursing practice, and that when it comes to caring for our communities at large, whether it be the maternal child health nurse or any nurse, public health, we're talking about looking at the needs that are specific to either the individual or the community, and understanding the needs of the subcultures that do exist within that community. When we provide nursing care to our clients, that's a constant. It never goes away. It's not unique to, let's say, the obstetrical population, or if I'm a town health nurse, the public health aspect, or if I'm a PACU nurse recovering patients over at the Beth Israel, I'm still applying that model that we are taught in nursing school. You yourself, I was myself all those years ago, that we're working within an individual, within a community, and we're addressing all of those needs. So a nice list here on this slide of just sort of demonstrating what is a safe and effective environment when we do provide this care to our client. Most things that you see on this list are things that you've been practicing already as student nurses, but we want to make sure that we've checked every box when we talk about how do we provide a community of safe and effective care for our clients. And at the same time, are we able to promote health within the community and within specific cultures? And do we do that in a way that's respectful and sensitive? And are we always looking at how do we counsel or educate our clients so that we can promote wellness, prevent those diseases, and make sure that they're getting adequate health screening to identify any risk factors or changes as they move throughout their life. Physiological integrity, when we look at that, we're looking at all of the things that allows an individual's body to do biologically, physiologically, what inherently needs to do to survive and be healthy and thrive here in their lifetime. So since this is your community and culture lecture for this semester, we can look at how does culture impact those things. And this is a really interesting list, because if you really think about it, you can see where, culture can impact things such as holistic care or complementary adjunctive medicine. So those things like maybe acupressure or acupuncture, blood and blood products, whether the patient can or can't receive them based on their belief system. Non-pharmacological interventions, how much would that be valued with my client? Maybe it's the only thing that's valued by my client. Nutrition and palliative care. These are all real, true discussions that sometimes have to be had with clients to make sure that they're able to make the best decisions they can about their health care. And just another list of those things that can impact physiological integrity. So incorporating in that cultural component, and how does it impact my client? So this is just a visual that kind of shows in a visual way the model or the concept of transcultural nursing, and how do you do a transcultural assessment. So as you learned in your first semester of nursing school, there's lots of nurse theorists that have spent better parts of their career identifying the theory behind nursing care. And the transcultural nursing theory is strong and thriving across this nation. And this is just a little visual depiction and showing you that if you look at that cultural individual over on the left-hand side of your screen, and you can see that some of those factors that would make them culturally unique, and then how it links to all the different manners in which we have to assess our clients so that we can deliver adequate care. So since we're talking about culture, let's talk about our culture, and that is healthcare settings. When the individual comes to the hospital or the long-term care facility, anything that requires them to be inpatient or even semi-residential, we have to remember that they have come to our um, really where we work. So who is in their comfort zone, the healthcare professional or the patient? And it's likely that you said, actually, that's my comfort zone. And it is. It's not a comfortable place for the patient, and we must recognize that. When we get out into those community settings, like a clinic or a support group or a place where they're going to maintain health, well, now the scale is balanced here because it's likely that the patient begins to become comfortable in that community setting. They feel like it's part of their community, it's in their community, and we feel comfortable because it's our clinic or our program that we're running, and there's a nice balance. And that's why community care is so important today. When we go into the home, the actual home of the client, whose comfort zone is it? It's the client's comfort zone. It's actually not ours. And oftentimes, when you talk with home care nurses who do this in the home, they will share with you that there are many moments where they actually don't feel comfortable because they may not have the resources they need, or it's just not a familiar setting, or it's sounds and sights and smells, and it's just different. So it's really interesting how you can take healthcare and really kind of tip the scales, if you will. This last video, I'm going to have you watch it on your own, is it's actually a wonderful video, and it's talking about that empathetic, that we, the healthcare professional, and our client, what's going through our minds, the unspoken word. I know when I saw this video a few years back, I can honestly tell you that it impacted my care so much so that I actually look at the way I move about in my settings differently because of this video, and I hope it has a similar impact for you. Many of you may want tissues, by the way, when you watch this, or you may have seen it before, but I really encourage you to click on it and just really, in a mindful way, see what it has to offer. And then finally, Donna Bishop, this is, excuse me, this is her presentation, and she did use Silvestri's cultural diversity and health practices is part of this presentation to get some of her information as well as your textbook. So that wraps up community and culture, and have a great weekend.